All right. Well, good morning or good afternoon, everybody. We are ready to get started with today's webinar. So thank you, everybody, for joining us. And thank you, Dr. Sventek, for joining us as well. Today's webinar is about eye care and the comprehensive eye care on campus. And so before we get started, just a couple of housekeeping items while we wait for some folks to join us here on Zoom and on Facebook. We are live streaming on Facebook. So if you have any family members, friends, students who would like to check our Facebook live stream, it's going on now. And also, if you're here on Facebook, on Zoom, welcome. Both of you on Zoom and Facebook will have the opportunity to submit any questions that you have on Zoom through the Q&A section and on Facebook through the comment section. So if you see me turning my head, it's because I'm monitoring Facebook as well, and I will send those questions and share those questions towards the end so Dr. Sventek can answer those questions. And I'm sorry, I hope I'm saying your last name correct. I love your last name. So we'll go ahead and get started. Remember, at the end of today, you will get a post-webinar survey. We always want to know how we're doing, what else we can do to keep you informed, and know about the resources available at UAB. So without further ado, I'm going to pass it on to Dr. Sventek so she can go ahead and get started and tell us all about eye care on campus. Welcome.
Awesome. Thank you so much for having me. Well, I'm here, of course, representing UAB Eye Care. And we're going to talk a little bit about who we are and what we can offer for everybody on campus. We are, of course, going to be your comprehensive eye care source. And our vision, your vision is our mission, of course. So a little bit about me. I am an assistant professor here at the School of Optometry, but more importantly, I am an optometrist at UAB Eye Care. The School of Optometry has their clinical division of where the students get to train at UAB Eye Care. We are across from the School of Nursing and right next door to Callahan Eye Hospital. That's where you'll find us. It is about a 34,000 square foot building. Our clinic is on the first floor, and then we provide obviously comprehensive eye care, as well as we go into the community too, which we'll chat a little bit about. Our clinic is very newly remodeled and beautiful. And of course, we would love to take care of all of your eye care needs. Specifically, we want to be your home away from home, right? So eye exams are recommended every year, and sometimes just with our schedules, it doesn't work out to continue seeing our eye doctor at home. And so we're happy to be that resource for you while you're here on campus. In addition to our regular primary care, pediatric, and contact lens clinic, we also have specialty clinics. And so you'll see here some of those clinics are listed. Our dry eye clinic, you might be thinking, well, I'm young and healthy. I probably don't have dry eyes, but you actually might, believe it or not. A lot of times when we have excess screen use and we're on our laptops a lot for school and education, it actually can cause our eyes to become really dry. And so you might want to be seen in our specialty clinic if you suffer from that. We also have lots of other clinics. Another one notably is our concussion or our MTBI clinic. Sometimes when we have head injuries or concussions, our eyes can also start to have difficulty with seeing. And so that can happen for not only our UAB athletes, but also our, individuals who are doing club sports as well. So of course, in addition to our regular primary care and contact lens clinic, we have lots of other specialty clinics. We obviously also have an optical. Our optical is able to fulfill prescriptions for you. So let's say maybe you had an eye exam back home and your glasses broke, but you have a valid prescription. If you need to get a new pair of glasses ordered, our optical can certainly do that for you. We are able to fill outside prescriptions as long as they're valid and not expired. All of our opticians are American board certified, and we'll make sure that they're taking care of you, making sure your glasses are adjusted and put in the correct position. We have lots of different designer brands. We've got Versace, Kate Spade, lots of fun and new styles that are coming in all the time. We also are out in the community providing eye care. Our students and clinicians go and serve the underinsured or uninsured. We do go out into rural Alabama, local schools, and we provide a lot of care all the way into the Black Belt region as well. We do have an annual gift giving eye exam program called Gift of Sight that happens every year around Christmas, where we give free glasses and eye exams to those in need. Some of our community practice locations are going to be our 1917 clinic, our pathology clinic, Cahaba, ARMS. You can see them listed there. So we're not only just located next to Callahan and across from the School of Nursing, but we're also scattered throughout the community. We also have a partnership between UAB Athletics and UAB Optometry. It's what we call Blazer Vision. It's where we provide vision screenings for the athletes. And so if you are an athlete or coming into UAB as an athlete, you may get to interact with us and some of our doctors as well. We do a lot of baseline concussion testing for our athletes. So if an injury happens in the middle of season, we can document what it was like preseason and then after as well. We also are doing a lot of different clinical research. You can see the different areas of that research. We've got some studies in what's called myopia control, which is typically for children, yes, less than about 15 years old. We also have a dry eye research area and a concussion research clinic as well. If you're interested, I've listed some emails here for individuals that you can reach out to learn more about our research studies. So we're going to kind of dive into like, why is eye health important? Well, of course, it's linked to your overall health. It's important to have a holistic approach to your well-being. A lot of times we can look into somebody's eye and actually get a really good snapshot or an idea of what their overall health might be. For example, if you come in for an eye exam and we look into the back of the eye and you might have little bleeding spots on your retina, that could be an indication that you maybe have undiagnosed or uncontrolled diabetes or high blood pressure. So there's a few different things that we can do just by looking in the eye, and you didn't even have to have blood work done, which is kind of neat. So when should you schedule an appointment? Obviously, if you need a routine eye exam, new glasses or new contacts, but there's also some other reasons why you should schedule an appointment. Maybe if your eyes are feeling pain or they're straining while you're on the computer or looking at a book, if they feel red or infected, of course, those are reasons to come and see us. And it's important to note that we actually have on-call after-hour services. So we have our residents that are seeing patients. And so if it seems like it's after hours or a weekend, we highly encourage you to still call our regular phone line, and our residents that are on call can always take care of you, especially if it seems like it's something emergent, like an eye infection or a redness or a scratch to the eye as well. So here are the top 3 reasons why a UAB student might want to come see us. We're going to first talk about blurry vision, right? So sometimes if we have what's called uncorrected refractive error, meaning we need glasses but we don't have them, that of course can cause our vision to be blurry. So 70% of the US needs glasses prescriptions, and a lot of times when we're in school, because we're doing so much near work, our eyes can certainly shift. And so our prescription will kind of grow or change, or maybe you never needed glasses throughout middle school and high school, but now your eyes are starting to change. And you might be feeling like you're getting headaches or eye strain. Those would be certainly symptoms that you should come in to get glasses for. Now, there's different types of refractive error. The first one we're going to talk about is what's called myopia. And that just means instead of you being able to see clearer, your eye is longer than it should be. And so it creates an image that's kind of out of focus. This one's a little bit more common than all the others. About 45% of America is myopic. And so what we do for this is we give you a pair of glasses that just helps make that image clear and fall exactly on your retina how it should. Now, the opposite version of myopia is what's called hyperopia, which basically just means that you're farsighted. You can see really good far away, but maybe you need a little bit of help up close. And so only about 11% of the US has hyperopia. We prescribe glasses for this as well, and it helps make the image clear for you. The next type of refractive error is what's called astigmatism, and that means instead of the eye being perfectly round, it's a little bit more curved, kind of like a football or an egg shape. What it does is it causes the light when it enters your eye, it kind of scatters into multiple focal points. And so all we do to correct for that is, of course, once again, giving glasses. About 40% of the US has astigmatism. It's quite common. So we've gone over the number one reason why people might want to come in. The second reason is maybe if you're feeling like your vision is a little bit double or not as clear. It's been reported that about 80% of our learning comes through our eyes. And so if your eyes aren't doing exactly what they should be, then of course learning can be a little bit more of a challenge. Believe it or not, 17 visual skills are needed for reading, writing, and learning. And so there's a difference between just your eyes being able to see clearly and your eyes being able to function. And so that's where your accommodation and your convergence system comes into play. And so let's chat a little bit about that. Some symptoms you might be feeling if maybe your accommodation or convergence isn't working would be headaches, eye strain, maybe double vision. Maybe when you look at one word, it splits into two words. Maybe you lose your place when you're reading, or you forget what you read, right? You're having to reread it so many times you forgot what you even read. This can definitely become worsened by stress or lots of near demand, and some medications can actually even make it worse as well. So there's kind of three different vision problems that can happen that affect our learning. There's our eye tracking, our eye teaming, and our eye focusing. What does eye tracking look like? Well, when our eye tracking is not up to par, you'll notice in this example here that the eyes are kind of jumping around on where they're looking. They're having a hard time moving forward. We're having to reread a few words. And this can actually be retrained, and we can improve our eye tracking through what's called vision therapy, which luckily for our students here on campus, we actually provide a vision therapy clinic where we can help train the eyes and the brain to better coordinate so we can improve the tracking skills. Now, there's what's called eye teaming, and this would be more of a convergence disorder. And that just means that the eyes have a hard time teaming together, right? So when we read any material, our eyes have to turn inwards because the book is closer to us, or maybe our laptop or iPad are closer. Well, some people have a difficult time getting those eyes to team together. And then when they look at text, the words will kind of split apart into double a little bit and make it hard for them to kind of figure out where they're reading or what it looks like as well. Eye focusing is one of the last conditions that can certainly affect our learning ability. Eye focusing is an accommodative disorder, meaning that our eyes no longer can accommodate or keep the text clear. And so in this example, if those words look fuzzy to you, you're exactly right. This is an example of an eye going out of focus. And this skill can also be retrained in our vision therapy clinic. We do a lot of vision therapy for patients who have suffered from concussions, who suffer from this eye focusing disorder as well. So treatment options, I kind of talked about the vision therapy, but we also have the option of some specialty glasses with what I like to call a baby bifocal, which is just a little boost power to help the eyes. Of course, you would want to have a full comprehensive eye exam if your eyes are ever feeling strained or double, or if you're ever experiencing your eyes going out of focus. You certainly would want to come in for a full eye exam. The next reason that you should come in is because just because you have good vision and you can see well doesn't necessarily mean that your eyes are healthy. And so this is an example of, unfortunately, a 29-year-old woman who ended up having, I don't know if you're able to tell, but this kind of dark bordered area here that's hiding. Ended up actually being a melanoma. And so we did an eye exam, we checked the health of the eyes, and we were able to find this and diagnose that and get her the proper treatment and care. Also, these are all healthy individuals who were seeing really clear, but when we looked inside, we saw some different retinal changes. And so this top one here is an 18-year-old female, 22-year-old, 25-year-old male. And so just because you think you can see clear doesn't necessarily mean that everything is all healthy and okay in the back of the eye. This was a 21-year-old female that was having lots of headaches. And so went to a neurologist, couldn't figure out what was happening. Medicines weren't necessarily helping. Came in for an eye exam. We looked in the back of the eye, and I'll just preface this by saying this is supposed to be the optic nerve, and it's not supposed to look like that. So this optic nerve is really swollen and angry and not healthy. And so we had to prescribe some different medicines to make that better. Now, in order to get a better look in the back of the eye, obviously these are images, but when you have an eye exam, it's important that you have your eyes dilated. And so when we have our eyes dilated, we use an eye drop. Typically, we use what's called tropicamide. And what it does is it takes your pupil is typically a little bit smaller, and it opens that pupil nice and big. So when we shine a ray of light in, it stays nice and open so we can look at more of the back of the eye. If we compare these two images side by side, when we don't dilate the eye, we can only evaluate a small portion of the health of your eye. When we dilate, we can evaluate almost all of it. Obviously, once your pupils are really big, you become a little bit more sensitive to light. And so we obviously give you this little roll-on sunglasses to take you home. A lot of people think that you cannot drive once your eyes are dilated, and you certainly can. Obviously, it comes up to your comfort level. But luckily, a lot of students are on campus, and so we're only walking distance from the dorms. And so driving home isn't really a concern for them. When should you have your eyes checked? That's a good question. It really depends on your age. And so this is from the American Optometric Association. These are their recommendations of how often you should have an eye exam. Now, every 1 to 2 years for about college age, I would say if you're wearing glasses or contacts, that probably should be every year. The 2 year caveat there is if your eyes are healthy and you don't need glasses, then maybe every 2 years is appropriate. Insurance for eyes is super confusing. And so there's what's called vision insurance and medical insurance, of course. And so it depends if the exam you come in for, if it's a medical exam, maybe you're coming in complaining of dry eyes or an eye infection, or maybe you know you have diabetes. That would be something that would be billed towards your medical insurance. Now, if you are just coming in for a regular eye exam to get your glasses and contacts updated, then that would certainly fall under a routine eye exam, and that would go toward your vision insurance. Now, for our students, we do offer various discounts as well. We have what's called our green and gold eye exam, which is $89. We also have lots of different discounts for glasses and contacts. You can see some of them listed there. On the left side of your screen, you're going to see what insurances we accept. And if if you have a vision plan, it might be VSP, but if you have a medical plan, it might be Blue Cross or Blue Shield. And so some people have both vision and medical, and that's where it kind of can get a little bit confusing. Now, we do have easy online booking, so you can easily visit our website and get yourself scheduled for an appointment. And then what I'll do is I'll switch over to the next slide here. This is my last slide, and this top QR code will bring you to that website where you can easily schedule. You can also visit us at uab.edu/eyecare. Of course, we always recommend you to follow us on Instagram. We have lots of great content, and we also will share whenever we have promotions or sales happening. You can also just call if you'd like to make the appointment. The phone number is listed there. So I'll go ahead and pause, and I'm happy to answer any questions that anybody might have.
Thank you. This is very valuable information. I love the part where you said that we need to have our eyes checked, not once a year, but not every 2 years, but every year. And that also learning is our eyesight is so important to our learning. And sometimes we don't put them together, which is, it's key. So if at any point right now, anybody has any questions, I first of all want to thank everybody who's joining us here on Zoom and on Facebook. So if you have any questions, you can place them here in the Q&A section. The contact information and also how your student can make an appointment is posted right now. It is very important that, if your student ever needs any attention, you keep this number in mind. Sometimes your students will call you to find out the number. And so if you have it handy, this is very helpful. As we wait for some of the questions, and there may not be any right now, which is okay. Sometimes questions come up later. How, if the student is maybe suffering headaches, and sometimes families get the complaint from students, I have headaches. And so when is it prudent to visit the eye care doctor or wait, or some students associate it with stress? And so can there be a connection? And when should students seek some attention?
That's a tricky question. Headaches have so many different factors that contribute to them. Most commonly, it can be just as simple as dehydration, right? We don't have enough water. We all don't drink enough water throughout the day. And so I would say if we've kind of ruled out, the dehydration part of it, we're making sure we're getting enough sleep. We're making sure that we're able to see the screen clearly. If we're working on a laptop, making sure we're taking those eye breaks as well. If we've kind of ruled all of those things out, I think that an eye exam would be a great next step, right? You might necessarily think like, let me go get an MRI, right? Let me get a brain scan or something. But sometimes it's as simple as just, yeah, you needed glasses. And so that would be a safe and easy next step, is just to check that out. And of course, we work with providers all over campus. So if we decide, hey, yeah, your headaches are not from your eyes, we can certainly get you connected and referred to the correct clinics for that additional testing.
Thank you. I think that's important. And sometimes people do worry. And so having somewhere they can reach out to is very important. I don't see any questions right now, but as students prepare to transition back to campus or start at UAB, what would be some of your recommendations at this time? Having an eye exam now, waiting, bringing a prescription with them? What would you recommend?
Yeah, definitely bring, if you already have had an eye exam at home, bring your prescription with, have a copy of it, scan it onto your phone, take a picture of it. So in case your glasses break, same thing with contact lenses. If you normally historically wear contact lenses, if you have an updated prescription, keep a copy of that. If for some reason you lose your boxes of them and you need to order more, we can certainly help with ordering contact lenses. If you haven't had an eye exam and you'd like to transition your care to UAB Eye Care, we'd be happy to see you. I obviously recommend calling sooner than later. Sometimes our clinics are booked out a little bit. Sometimes we can get same day appointments as well. So don't bank on there always being a same day. It might not be a bad idea to call ahead, get yourself an appointment for a day and a time that works for you. And so you at least have that care and that provider in case something does urgently happen later on while you're on campus. At least you have that person you can reach out to as well. Some little fun tips that are helpful for back to school and learning. We always recommend after about 20 minutes of screen time to give yourself a little bit of a break, about 20 seconds. And when you take that break, you should actually look about 20 feet away. So just look down a hallway or out a window is even better. So after 20 minutes of computer use, take a break for a few seconds and then look far, far away and just relax your eyes. A lot of times when we spend too much time looking up close, it can actually strain our eyes, and then our eyes and our prescription continues to progress. And that's why taking that break every so often to help relax them is important.
I really like that tip that you just gave. I did. Oftentimes we don't realize we've been staring at the computer and how much, just even looking a distance away is useful. So that's a great tip. I appreciate you sharing that with us. So
Of course.
yeah, at this time we don't have any questions. But again, if any questions come up or if you would like to reach out to the Eye Care Center, the contact information is there. If you have any questions, you can always email us and we will send those questions over to Eye Care. But we wish everybody a great beginning of their academic year. As we get closer to the beginning of the academic year, we will be sending reminders. You can view this and other webinars that we have already had this summer on Facebook and on our website, uab.edu/families, under the communications tab. And again, if you have any questions about this, the past webinars, or any other aspects as you transition to campus, this is reach out to us at families@uab.edu. And I want to thank Dr. Sventek for being here with us today, and we look forward to seeing you for our webinars next week. So thank you, everybody, and go Blazers.
Thank you.